Hi guys, and welcome to my oral presentation about Down syndrome, and it is by me, Kaylee Norris. And today we're just discussing the general basis of Down syndrome, about what it entails and who it affects and what all it affects. So starting off, we have what is Down syndrome. Down syndrome, also known as trisomy 21, is a genetic mutation on the 21st chromosome. With this mutation of an extra chromosome is added to the chromosomal pair. So as you can see, I added a picture and you see that everything has a pair except for that one highlighted in blue. And you can see that a third extra chromosome is added on top, which leads to a mental disability as well as many complications to one's physical health. This affects multiple systems within the body that includes neurological, musculoskeletal, and cardiovascular. Moving right along, we have people that are affected. As of now, Down syndrome occurs in 1 out of 700 births. Some women pregnant with a child of Down syndrome miscarries. That could be finding out, oh, your child has Down syndrome, and the harsh stress on the body causes the woman to miscarry. It could just be the baby has complications while in the womb, or it could just be the mother itself having complications. 57% of women will have a premature birth, which is very high. I think I read it ranges from like 14 weeks early, 16 weeks, a couple of weeks. It just all depends on the person. 33% of women with a child of Down syndrome have terminations. They'll have a genetic testing done and they find out that their child has Down syndrome. And if they personally believe they cannot take care of it or handle a child with Down syndrome, most often the times they'll terminate it, leaving a small amount of people to have a natural birth with a baby of Down syndrome. Though as of right now, people who are born with Down syndrome have a life expectancy around 60 years, which is amazing compared to how it was back in the day. Back in the day, I read an article and it said in like 1944, average life expectancy was like 12, which is amazing. Mental limitations. So with this disorder comes along mental disabilities. These disabilities include intellectual disabilities, development delay, language challenges, sensory issues, behavioral issues, and Alzheimer's disease. So starting off with intellectual disabilities, that just means it goes hand in hand with most of the mental limitations like development, languages, and sensory and behavioral. Just saying that a 20-year-old person with Down syndrome can act like a 5-year-old regular kid. It might take longer for them to realize what the color blue is and how to say blue. You can have very high functioning Down syndrome and you can have very low functioning Down syndrome. You have kids that have outbursts and don't want to do their schoolwork because they don't understand and it's overwhelming for their brain. But then you have high functioning people that have work and they do all these sports and go day to day. That's like at my school, he's so precious. I help out with the life skill kids and he's so sweet, but he has behavioral issues because he gets overstimulated so easily. And he can barely talk, but he's the sweetest thing ever. But meanwhile, there's a person I follow on TikTok. She's a pageant queen who has Down syndrome, which is amazing. And Alzheimer's disease, it is coming to show that people with Downs are more likely for Alzheimer's disease, which makes you forget things easier. Your brain slowly deteriorates, which doesn't help with the already disabilities and limitations that are already at hand. Physical limitations. Not only do people with Down syndrome have mental limitations, they also have physical limitations as well. These limitations include being more prone to heart disease, respiratory issues, autoimmune diseases, and infertility. That's more of your biological, physical aspect of it. But I added a child with Down syndrome here that goes along with the statue, the tiny ears, the flat nose, the small mouth, and they are usually shorter. And with that being said, they're so short they can barely move. They usually have obesity, breathing problems. Overall, just the statue of them can cause complications to their physical health. And then aiding these limitations throughout the years, there has been ways of helping Down syndrome people have evolved. This includes putting them in speech and occupational therapy, helping them talk, helping them touch, helping them write a paper, frequent doctor visits to make sure all health is intact, having special classes that help them teach the kids what they need to know on their level. Just say, I have George here, he needs to read a book. Okay, I can help him read the first level grader book, but I have Clara here. She just wants to color, and that's all she knows how to do is color, so she learned on a biased way of coloring. And now they have job opportunities that help aid their needs that are especially towards them. They have more breaks, they have challenges that are not so challenging and can help them work through a daily basis. And these are my references. I just wanted to thank you for watching my presentation and taking the time to learn more about Down syndrome. I hope you've learned a lot, and thank you for watching.